Our next speaker is Dr. Catalina Hoyos, pediatrician with UPMC Children's Community Pediatrics GIL and assistant clinical professor of pediatrics with the University of Pittsburgh School of Medicine. Dr. Hoyos is passionate about addressing social determinants of health and promoting healthy early child development. Dr. Hoyos?
Good morning, everyone, and thank you very much. Can you guys hear me? I feel like I'm a little shorter than everyone who spoke before me. First, I'd like to say thank you to Maria for inviting me to participate in this symposium. I'm really excited to be here, and I'm very inspired to think more deeply about how I can connect my patients or reconnect my patients with nature. So I'm going to talk today a little bit about the evidence that people have alluded to that tells us that nature truly is important, particularly focusing on children, since that's my area of expertise. All right, so we're going to talk about child development using this definition because there are a variety of ways to interpret child development. The physical, intellectual, social, and emotional changes that occur from birth through the end of adolescence. In medicine, we do a lot of case-based presentations, so I tried to take some cases from my practice to illustrate some of the evidence. Our first case is EC. He is, it's a picture of a girl, but he's a boy. A healthy 6-year-old child with no significant past medical history, no family history. I can tell you from speaking with Eve's family that they believe deeply in this concept of biophilia. They actually call nature their church, and they're out there every weekend. They see it as a way of calming E, as a way of connecting with him and connecting him to nature and teaching him to protect nature. So I'd like to contrast him with what the research is showing us, that kids are spending a lot less time in nature for a variety of reasons. Access being one of them, that's often mentioned. Some of you have talked about biophilic cities and having the nearest park or green space being less than a 5-minute walk away. The research shows that that's very important. 5 minutes is kind of the key interval. There's also safety concerns, of course. I see that when we give our patients what are called PARCS prescriptions. Dr. Kondo spoke a little bit about that yesterday. We are one of the pilot pediatrics practices that are handing out prescriptions that prescribe time in nature and have links to the nearest parks for our practice, which most of our patients live near our practice. And so overcoming some of those barriers is important. And starting to the discussion is also important in our office. So that's part of the reason I take the time to do this in my clinic. Okay, so what does the research say? The research says that exposure to nature actually decreases perceived stress or is a buffer for daily stress as experienced by children. One of the most cited articles is this Wells and Evans paper from 2003, where they looked at rural children, actually. And when I think of rural, I think of nature, but they graded nature, and they found that children that were exposed to the most nature really had less parental report of stress. There's also studies in schools that exposure to green schoolyards is associated with less perceived stress and improved daily focus, and provided supportive social groups. So kids would, in this study, they looked at a variety of different schools with different schoolyard settings, but they found that kids were naturally drawn to the green spaces and were finding their own sort of peer groups in those spaces sort of by who liked which kind of nature, which I thought was really cute and just shows that nature is sort of intrinsic to our DNA. Another study showed that when you asked children to report on their difficulties, they reported them much less when they were exposed to high quality and high quantity green spaces. This study was done in Barcelona, actually, and the kids were exposed both to green spaces and what they called blue spaces, so the ocean. And they reported fewer difficulties, but also improved peer relationships. This is a map of Pittsburgh and some of the green areas and parks here in our city. Okay. I wanted to talk a little bit about adults because in pediatrics, the family unit is so important. And as you can see, we have a lot of green spaces here, but engaging the family is key because they're the ones taking the kids to the parks. I can't ask the 3-year-old or the 6-year-old to walk to the nearest park necessarily, but I can try to engage the family and try to tell them this is also good for you. So we know that greater time spent in nature leads to improvement in mental and social health. There's a lot of research on adults especially, and this was just one of the pieces. They also reported less depression and more connectedness to nature from the Cox article. All right. So how does nature affect the child's sort of sense of self and self-esteem? Several studies have showed that there's a positive impact, particularly of wilderness programs where they're taking kids out into nature, and a lot of them are like challenge programs. And the kids then report afterwards how they perceive themselves, their own self-esteem, and one of the 3 sort of main things that they positively reported on were significantly positively reported on were self-esteem, autonomy, and decision-making. One of the things that I found very interesting about this research is that it showed that the benefits sometimes occurred even before they went on the experience and lasted sometimes up to months afterwards. Okay, case 2. So nature and physical activity. So this kid's name is Ryan. He's 14 years old. He was told by his pediatrician, which was not me, that he was overweight. And the pediatrician said, "What can you do to lose weight?" And the kid said, "I can play basketball." And about 2 years later, I see him and he's lost 20 pounds. And his mom is actually very worried that something is wrong with him. How did he lose so much weight? And is there something else going on? And luckily there was nothing else going on, but simply this kid really just took to heart what the pediatrician had said to him and was going out there and playing basketball with all kinds of different people, meeting new people, and really exercising. And our recommendation is about 60 minutes per day. And he was doing that, and he lost weight. And that was just a fantastic example of what our conversations really have the capacity to do, and what children really have the capacity to do. I put the picture on the side here is actually Planet Fitness. I saw this at our local library, which is actually quite close to one of the Planet Fitnesses. This teen workout free all summer long program. So I took a picture of that and printed it and put it up in my office so that kids knew about that as well. And kudos to Planet Fitness if anyone is here from there. That's not my gym. So how does nature interplay with physical activity? I mean, a lot of physical activity in children does take place outside. This is looking at nature, not sports or organized activities, these studies. I just want to mention that. Strong and his collaborators published in the Journal of Pediatrics, which is sort of like the Bible of pediatrics, when they put out their report of their recommendations, and they said that physical activity, as we all sort of know, but they looked at a lot of studies, did improve health outcomes, including adiposity, so fat, cardiovascular health, and also mental health, but that's a different slide. There's also just recently published an article that mentions that nature play positively impacts physical activity in children. And that was trying to target whether it makes a difference, whether it's structured play environment like a playground or a field or just a natural play area. So they found that it does lead to more increased or more physical activity, but not necessarily different than the traditional play spaces. And then the last study was a very longitudinal study where they looked at children over several years, I think 4 or 5, where they tried to see, okay, where were they at time 0 and at time 2 or time 1. And then they noticed that the kids that had baseline increased physical activity and were at baseline spending more time outdoors, when they tested them again, there was up to 41% less chance of being overweight. All right, so my third case. My third case is Jericho. He's a very, very special patient to me. He's a 14-year-old boy. He's obese. He has asthma. He has attention deficit hyperactivity disorder, a history of truancy in school, and marijuana use. I started this conversation with him and his mother when I gave him a Parks prescription, and his mom started talking to me about all the reasons she loved the parks and how they're going to go out there as a family. And what I learned from developing a relationship with them is that Jericho's mom has a history of mental health issues herself. She's overcome substance abuse, and she wants to treat Jericho in a really holistic way. So can nature help Jericho? The answer is yes, as you might assume. So I'm particularly going to focus on his ADHD because we've already talked about the obesity, and I'm not even going to go into asthma. But so children with ADHD score higher on attention testing after a 20-minute walk in the city park versus other urban settings. So that's very important for someone like Jericho, who's having a very hard time focusing, who's talked to his school counselors, failing out of school, skipping school because of the issues at school, and so kind of self-medicating himself with the marijuana in many ways. Green outdoor settings also seem to reduce ADHD symptoms in children, and these are papers that have been mentioned before by Faber and Kuo. All right. Another slightly older paper shows that children with behavioral problems, when they experienced nature, specifically in these therapeutic outdoor programs, the parents then reported less problematic behaviors. And I think that article actually, it was a family-based therapy, just to be clear. So we know that greater exposure to nature is associated with lower maternal reports of conduct issues, anxiety, and depression. So all of these are applicable to Jericho. And this is from the Wells and Evans paper in 2000. Again, this was in rural kids, but it seems to be pretty applicable. All right. This is my last case. This is Muhammad. He's an 8-year-old boy. He has type 1 diabetes. He's autistic. He's nonverbal, and his behaviors are difficult to manage. So much so that the first time I met him, he sort of hid under the table, and I was unable to examine him. And I sat on the floor trying to build some sort of rapport with him and kind of understand where he was at. But he's tough. His mom is actually also a doctor, and she is a blessing to that child. Her patience is amazing. But even with her sort of positivity and her engagement, Muhammad is still spending more than 4 hours a day on a screen because that's the only time that he is calm and not exhibiting these often aggressive behaviors towards his siblings particularly, and mom as well. So what does the literature tell us about nature and autism? So there isn't as much research on this, but this one article from just last year showed that parents and caregivers of children with autism reported improvement in motor, sensory, and emotional and sensory those improved after contact with nature. And these are sort of the key aspects of autism. Also, children with autism, part of their issue is they often have ADHD as well, and it's very hard to sort of piece those out. But the attention restoration theory comes a lot into play here in the autistic children as well as the children with ADHD, which basically shows us that if we step out into nature, for some of the studies are showing for a time period of even 5 minutes, our attention can be greatly restored. So I think of that as something that can be implemented in these kids' lives on a daily basis when they're showing poor activity or inability to focus in school. That's something that can be done. So I've showed you the research, but there's a lot of limitations to these types of studies. They often rely on interpretation or caregiver reports because you can't ask a 3-year-old, how did you feel after being in nature? So we sort of interpret their behavior after exposure. Often, because these are surveys done afterwards, their participants may want to be supporting the program, so may answer positively because they know that will support the program. They're often self-selected. For example, you can't randomize where people live, close to nature, far from nature. So there's some limitation to that because maybe people who are more emotionally robust are choosing to live closer to nature. The studies are often looking at activities in nature. So is the positive effect because of the activity and not necessarily because of nature? Some of the work does do the same activity in nature and indoors. So to try to limit that. There are often small sample sizes, and there's a huge variety of study design, quasi-experimental, retrospective, and much less so randomized controlled trials which is in medicine are sort of golden standard. So I want to leave you with some action points since I'm running out of time. I'm going to pull them all up. Just like Maria charged us with yesterday, go outside, enjoy nature, wander and wonder. Encourage the children in your life to explore nature and be curious. Show them that you care about them and about nature. I try to do this in my practice in the way I model my attitudes towards the children so that the parents can see what that looks like. When a child asks a question, I try to answer it because that shows them that we care what they're thinking about and we want to encourage their curiosity. And we can often link whatever they're curious about to nature. I also want us to think about how we keep nature accessible by partnering with local organizations and institutions like our local schools and parks, the FIPS, for example. And then I want us to make sure that we're all out there trying to protect and expand the existing nature by picking up trash at our local park next time we're out there playing with our kids or on our next hike, or joining groups that go out and actually maintain the trails. I live very close to Frick, and I see this happening all the time. Writing to our government officials, and of course this year, make sure you all get out and vote. Thank you.